Welcome to this week's episode of Mohawk Valley Living TV. Today we take you inside Mohawk Valley Health System as MVHS celebrates Nurses Week and Hospital Week, honoring the dedicated healthcare professionals who care for our community every single day. Then I sit down with MVL Health Editor and Emergency Medicine Physician Dr. Juleen Qandah for an important conversation about heart health, prevention, wellness, and why understanding your risk factors matter more than ever. And Sarah Foster Calero joins me to talk all things America 250, including upcoming celebrations and how Oneida County is preparing to commemorate this historic milestone. Today I'm here with MVL Health Editor and my very good friend and ER physician, Dr. Juleen Qandah.
Thank you, Carrie. Thank you for having me.
Oh my God, thanks so much for coming and for your contributions on a monthly basis. I actually had someone walk up to me and tell me that reading your column has really made them start to think about what they need to ask their PCP and all of that stuff. So
wonderful. That's the purpose.
Right? In the May issue, we talk about hypertension.
Yes.
So I know May 17th was World Hypertension Day.
Yes.
And tell me a little bit about why it's important to recognize this, and really, you know, what people can do to kind of check their blood pressure, right? I mean, that's what we're talking about here.
Exactly. Okay. We want hypertension on everyone's mind. I'm not trying to scare people, but this is why we call it the silent killer. Okay. And the reason is because you don't feel like you're sick. You don't feel it, you don't know it. Sometimes patients with extremely high blood pressure will say to me in the ER, oh, I feel a whooshing in my head, or I feel ringing in my ears, or I just don't feel right. But most people do not feel that their blood pressure is high. And then they come into the ER for a separate issue, and we check their blood pressure because it's part of their vital signs on arrival in triage. And we note that it's extremely high, and we say, have you ever been diagnosed with hypertension before? And they say, no, I've never been checked, or I've never seen my family doctor since I was a child, or so it's extremely important that people know their numbers. So
what are the numbers? Because I feel like some of the stuff changes, right? So I always remember 120/80, you're good, right?
Yes.
Is that really good, or do you want to be a little lower? What's the sweet spot?
The best thing is around 120/80. A little bit less is probably ideal. So less than 120/80 is considered normal now. We have gotten stricter with our guidelines as far as diagnosing hypertension because we want people to recognize it earlier, and we want people to also be able to get on the right medicines in a timely fashion. And then if it's not controlled, which we know 75% of adults who have hypertension in America actually do not have it under adequate control, meaning their numbers are not where they need to be, and we're not being aggressive enough with those folks with their blood pressure medicines. And we know that 50% of Americans actually have high blood pressure, so it's extremely common. And unfortunately, it starts a whole cascade of medical problems for people for the rest of their lives, because what happens is patients who have high blood pressure, if they don't know it, they're not getting it regularly checked, they're not getting treated, it's slowly and gradually over years and decades damaging the inside of their body. Really? It damages their retina, it damages their heart, it causes congestive heart failure. It actually damages the inside of your arteries, where your arteries become stiff and narrow and are more vulnerable to like cholesterol plaque buildup. And we know that high cholesterol and high blood pressure go hand in hand. They both cause each other. So when you have hypertension, it can lead you down the path of accumulating plaque in your arteries. We also know that high blood pressure damages your kidneys. Unfortunately, a lot of folks who don't know they have high blood pressure or did not have it treated for a long time end up on dialysis, which is a very sad situation because they go into kidney failure. So there are so many things that, blood pressure being too high causes, stroke being the major one. I help Rome Health with their stroke program, and I'm the director over there, and I see that hypertension is the #1 risk factor for having a stroke. So, and it's not, and one point I want to make is it's not like one reading. It's like the trend of readings.
Right.
You know, patients will say, oh, my blood pressure's 190, but I feel completely fine. Should I go to the emergency room? No, not unless you're having signs of an emergency. So not unless you're having chest pain or difficulty breathing or neurological symptoms suspicious for a stroke. What we want you to do is, you know, recheck your blood pressure at home, call your primary care doctor. And another, you know, a few points that we want patients to also be aware of is how to check their blood pressure appropriately. You should bring your cuff or your machine into your primary care doctor, get it calibrated.
Make sure it's working the same as theirs. You can also go to some drugstores, and there are other locations. I know the American Heart Association has installed them in different communities where you can go in and get it checked.
Yes, so, and it's free too.
Yeah, just
so why not
get it
stop
done,
in
right?
Walgreens, CVS, you know, go get your blood pressure checked for free.
So other than medication, are there lifestyle changes someone can make if they are diagnosed, maybe it's early, right? And they're just finding out they have high blood pressure? What do you do?
Definitely. So healthy lifestyle is, I would say, probably nowadays the #1 cause of high blood pressure. Yes, it's age. The older you are, you know, the stiffer your arteries, especially postmenopausal women. You know, we lose estrogen and your arteries get stiffer. Definitely elderly folks. But nowadays, with our, unfortunately, obesity rates and our levels of alcohol and tobacco use, those are secondary causes of hypertension that we can change. We can't change our family history, right? So we can't change, you know, our blood pressures of our mom or dad. We can't change our ethnicity or our, you know, nationality, backgrounds, but we can change our lifestyle. We can get physically active. And I'm not saying you need to go run the Boilermaker.
Right.
Just walk a couple miles a day, you know, do those power walks.
Get moving.
Exactly. If you use tobacco, please try to quit. There are so many good ways to quit now. People don't realize that, you know, smoking and regular alcohol use raise your blood pressure. And if you stop those, your blood pressure will probably be lower.
Right.
So, you know, in those early reversible kind of stages. So there's definitely a lot of lifestyle changes, you know, physical activity and modifiable risk factors that we can change is very, very, you know, beneficial in the cause of treating hypertension.
That's great. So get out there, definitely get your blood pressure checked.
Yes.
Not only by your PCP once a year, but again, try and go to some of those other locations.
Definitely.
So Dr. Qandah, thanks again
Thank
for
you so
coming
much.
on. Let's have you back on next month. I know
Thank
we have
you
other
for
stuff
having
to
me.
talk about. We've got we just had the AHA Go Red Luncheon, and we're definitely thinking about CPR and all sorts of other stuff, so I'd love to have you back.
Wonderful.
Maybe we could even do a little demonstration too.
AED coming up.
Yeah.
Very good.
Thank you. Coming up, we head to MVHS to celebrate Nurses and Hospital Week.
We are the best spine care facility in the region. We are providing world-class care for our patients. We are Central New York Brain and Spine Neurosurgery. Suffering from neck pain, back pain, frustrated because you can't get any relief? Let Dr. Q and his staff provide you with the care and compassion that you need. With the latest and greatest technology, Dr. Q and his staff will help get your health and your life back to what you deserve. Dr. Q cares about you. Call us today.
A fence is an important investment. It defines your space, provides security, and reflects on the pride you take in your property. At B&K Fencing, we just don't install fences, we build solutions. We take a hands-on approach with every client. Our commitment is to superior craftsmanship and durable materials. Whether it's classic wood, low-maintenance vinyl, secure chain link, or elegant aluminum, quality is non-negotiable. We ensure that every project, large to small, is built right, built to last, and delivered at a fair price. That's the standard we uphold at B&K Fencing.
We are strategic. Want to know what we do? It's simple. We help you live your great life. That means great financial planning, straightforward investment strategies, and guidance when life throws a curveball. Retirement, college, taxes, and big decisions. Spend less time worrying and more time living. Strategic, life by design.
We're stickering everything, Finley.
It's the Made in America sale at New York Sash.
Good job.
I thought you two were getting ready for the sale.
We are. We're stickering all New York Sash products made in the USA.
Isn't that everything? It's America's best, installed in central New York for less. We're taking 25% off vinyl and engineered wood siding, acrylic bath systems, energy efficient windows, and entry and storm doors. Visit NewYorkSash.com.
There's another sticker.
Okay, it's all fixed. No new parts, under an hour, no charge.
I don't want to make any decisions right now.
Don't worry about it. It's no charge.
Now, I really can't make a decision like this without talking to my wife. But I will decline the charges.
Sir, there's still no charge. You have a good night.
The green team doesn't sell, they solve. For unexpected wins, get on the green with Standard.
Wait, you didn't even ask for my email address.
I had been lifting something heavy, felt a tinge in my back. I also had some shortness of breath, but thought it was due to what I figured was some kind of muscle pull. I was wrong.
The episodes of pain that Ray was experiencing were actually small heart attacks. The Wynn Emergency Department was able to provide immediate life-saving care to Ray's heart.
If it wasn't for the amazing team at Wynn, I might not be here at all. I feel indebted to everyone who helped make Wynn Hospital a reality so I can get the immediate care I needed right when I needed it.
Thank you for giving my daddy back home.
Welcome back to Mohawk Valley Living TV. Today I'm here at Wynn Hospital with Courtney and Maggie. Hi guys. Hello. Thanks for joining me. It's obviously an exciting week here and an exciting day. We are in a carnival right now, yes. Right? So Courtney, you are a senior nurse manager here at Wynn Hospital, and Maggie, you work with the St. Elizabeth College of Nursing. Yep. And obviously there's a lot of excitement. It's Nurses in Hospital Week here, so I gotta tell you, this is amazing. I see cotton candy, I see popcorn, I see carnival food and games, and a cakewalk coming, which is musical chairs with cakes. Yes. I don't know who came up with that idea, but it's a good one, and I might steal it for a party. So tell me a little bit about, Courtney, we'll start with you, what this means to the workers at the hospital and the nurses.
You know, we have our new CEO, Dr. LaCates, and our Chief Nursing Officer, Julie Hall. They really have a huge focus on employee engagement and making sure that our employees feel really recognized for all the hard work they do every day. So this is just a small tidbit of what we do to celebrate that. And definitely not a small tidbit. This is an immersive experience, right? I mean, this is amazing. Maggie, what about you? What does this mean to the staff? And obviously you're working on, you know, the future, like nurses and leaders coming up here. So what does this mean to you in kind of nurturing those people in that profession?
I mean, same thing. It's just the acknowledgement and getting everybody together and showing that you're appreciated. It doesn't matter what role you're in. We all play a part, and it's good team effort here. So it's a good way to show that. Like, let's get together, lean on each other in a different way, and have a good time.
Mm-hmm. So what are some of the other things that you guys have been doing around here to kind of celebrate the nurses and the hospital staff?
So last week we had the Freedom Guide dogs come in, and we were able to pet them and interact with them. We did ice cream socials for day shifts and the night shifts. We're also having Carnival Day tonight as well. Okay. Also, some of our local fire departments and EMS staff came and did a parade to light up the night near the Wynn Hospital down Columbia Street. It was really amazing. Really awesome. Really amazing. Yeah. And Maggie, I know you have a graduation coming soon with your next class.
Yes, we have graduation this weekend, so students are very excited, and we've been doing, you know, little events there. They've had a lot of cake. We've also, you know, MVHS is really great about making sure that everyone's gifted something. Mm-hmm. So every employee has received a gift for Nurses in Hospital Week.
Oh, I love that. I absolutely love it. So one of the things we talk about is obviously the excitement of a day like this, but again, like you mentioned, I think, Courtney, employee engagement, mm-hmm. and Dr. LaCates and Julie really kind of pulling everyone together to show the appreciation. And I mean, it's something from a community aspect that we definitely appreciate. I mean, obviously we're in a beautiful space. Wynn Hospital could not be more beautiful from a functionality perspective, but to have all of the employees, nurses, and hospital staff feel that appreciation from the community through the hospital administration is amazing, right? Yeah. And is it something you see with your students coming up, that they're excited to come here and work?
Oh yeah, absolutely. And they do a lot of their clinicals here, so they gather that rapport with the nurses, your housekeeping staff, your food service staff, so they're very comfortable once they get to the spot.
That's amazing. Yeah. And I know, Courtney, you went through that program, right?
Yes, I did. It was a great experience. This year we've hired over 75 graduate nurses from local colleges. So we're super excited to have them be a part of our nurse residency program and help grow them in their careers.
That's amazing. I know I spoke with Dr. Zimmer recently, and he had mentioned the number of new hires coming in, doctors, nurses, and it really is a testament to the way, you know, MVHS is running and the hospital system that we're able to get all of these people here and stay in the Mohawk Valley to work, right, and support our healthcare system, because there's nothing like Mohawk Valley residents caring for their own.
Yeah.
Right?
Absolutely.
All right, so what do you guys have planned for the rest of the day? Are you going to partake in the carnival for a little bit, play some games?
Oh, yeah.
Yes, absolutely.
Yeah, I'm the DJ, unofficially.
You are the DJ, so is that just today or other events?
Other events too, but
All
yeah,
right.
this is one of the bigger
You're
ones.
like going to spin some...
No requests.
No requests. I love it. Courtney, what about you? What do you have planned for today?
So I'm going to participate in Carnival Day, make sure the staff get to come down and celebrate as well, and then later this week we're actually having Nurses Night Out at the Stanley Theater for all the nurses to come and celebrate. So it's super exciting.
What's going to happen at Nurses Night Out at the Stanley?
There will be cocktails, food, and then we're also going to be giving out some awards for nursing leadership, and then recognize some of our great nurses that we have here.
Wonderful. I know we've had a bunch of Daisy Awards out recently, which is so great to be able to kind of focus on people that are making a difference in the everyday lives of the community.
Yeah.
So thank you guys so much for having me here. I mean, I saw the spread. You guys are going to eat well today.
I hope you get some too, then.
Well, we'll see. We'll see. I mean, it looks amazing, but this is really about everyone that works here. So I'm just happy to be a part of it and spreading all the great news that you guys are doing here. Thanks again. Thank you. Coming up, Sarah Foster Calero joins me to talk all things America 250.
We know pools. Garrity Pools and Spa are the experts in building and creating backyard memories for thousands of families. Garrity takes pride in offering only the highest quality in-ground Pacific pool and radiant above-ground pools that are built for upstate New York weather. Garrity offers only the best with BioGuard chemicals to keep your pool sparkling clean. Visit the professionals at Garrity Pools and Spa, 234 South Caroline Street, Herkimer, or GarrityPools.com.
Okay, here's the estimate for your new HVAC system. Whenever you're ready, you can sign right here.
I'll need my lawyer to look over this.
Looks good. No issues.
What about the fine print?
There is no fine print.
What's this, a $3,000 charge?
That's a credit. You get that.
Correct. That's a credit through the state.
Well, what should I do?
Sign here.
For unexpected wins, get on the green with Standard.
You know I'm still billing you for this, right?
Before you're playing with the pros, you've got to get your start somewhere.
The Steve Ponte Auto Group is proud to support our local and youth sports organizations throughout the area. Supporting our teams that our families live, play, and coach at is so meaningful to us.
From Little League Baseball to basketball, flag football to hockey, and the Boilermaker Road Race, the Steve Ponte Auto Group is proud to support local sports and foster the love of the game and teamwork.
Visit our website today and learn more about our community involvement.
Hear ye! Welcome Roofing Royalty to your home. The King awaits with bountiful savings. The Roofing King can help you with all your roofing needs. The Roofing King and all his men have the royal plan with perfect installs, maintenance, repairs, and free inspections. Call 315-269-3519 or visit roofingkingusa.com today. Save yourself time and money with your roofing professionals, the Roofing King.
We're stickering everything, Finley.
It's the Made in America sale at New York Sash.
Good job.
I thought you two were getting ready for the sale.
We are. We're stickering all New York Sash products made in the USA.
Isn't that everything? It's America's best, installed in central New York for less. We're taking 25% off vinyl and engineered wood siding, acrylic bath systems, energy efficient windows, and entry and storm doors. Visit NewYorkSash.com.
Here's another sticker.
It's here, the only robotic GPS in the state outside of New York City. The Excelsius GPS. No need to travel to the big cities. The best technology is right here at Central New York Brain and Spine Neurosurgery. The Excelsius GPS provides a safer and more precise surgery with better outcomes for you. Improved accuracy, less time under anesthesia, and incisions are reduced to only millimeters. For world-class care and the latest technology, call Central New York Brain and Spine Neurosurgery, where Dr. Q cares about you.
Welcome back to Mohawk Valley Living TV. Today I'm here with Sarah Foster Calero from Oneida County Tourism. Hi, Sarah.
Hi, good to be back.
Thanks so much for coming back to our studio. And, you know, May is out and we have your amazing column, Buzzworthy.
Yes, yep, love it.
Which shows us everything going on in Oneida County. And one of the things I really wanted to talk about was America 250. Aside from obviously seeing it in the magazine, you drive through Oneida County and the Mohawk Valley, you see little signs around, you know, and really let's talk about not only what it means, right, and how significant it is for our entire country, but, you know, how are we going to celebrate this in Oneida County? What do we have coming up?
Yeah, so there are so many events coming up, and I am thrilled to be on the commission for Oneida County. So they established that at the end of 2025, and the group is comprised of different partners with heritage tourism sites, Oneida Indian Nation, of course Oneida County Tourism, and then Oneida County Government. So we've really been working as a group to figure out, you know, what is the right strategy for us as a county? How do we highlight everything that's happening? So I love the fact that on Oneida County Tourism, we host the official landing page right on our website. It's super easy to get to if you go to OneidaCountyTourism.com. Like right at the top, there's, you know, the call to action that will take you to that landing page. You can also go to the URL OneidaCounty250.com and it will bring you there also. On that page, we have every event that we are learning about. And so Mari on our team has been reaching out to all our partners and saying, do you have an already existing event? Are you planning a new event? We know there are a ton of Memorial Day parades, 4th of July parades. And so we're telling our partners, you know, you don't have to create something new. Just theme it for America 250, and then we'll be able to promote it. So that's all on there. Also right at the top are the major historic attractions within Oneida County so people can learn more about those. But it's a lot happening, and it's basically about to start kicking off.
It's some great stuff. I was actually at an event recently where even talking about Fort Stanwix. I mean, like, there's so much great stuff here to really kind of engage in historical, you know, United States, you know, history and all of that stuff. So obviously we have Memorial Day tomorrow. So that's
how are we here already?
I know, how are we here? But, you know, after that, July 4th is going to be the big one.
Oh, yeah.
But then you mentioned to me, it just continues on. So
yeah, as a county, I think we really decided that instead of trying to rush that process, of course, let's highlight everything happening for Memorial Day, but 4th of July is technically like that real kickoff. And then we will run well into 2027 because the Battle of Oriskany has their 250th anniversary next August. So I think it's a great opportunity for us. You know, as a county, we really want to drive locals to understand what's happening in their own backyard, but also looking at this as an opportunity of bringing people into the area. So recently I had met with the Oneida Indian Nation to ask what they had planned, and they told me that they have an exhibition that will be in DC this summer, I think in July, that is entirely focused on the Oneida Indian Nation. So that's an opportunity for us from that marketing perspective to kind of like geo-target those people and say, hey, you've learned about Oneida Indian Nation, why don't you come and experience it firsthand? And so working with the nation, with Fort Stanwix, the battlefield, even looking at our neighboring counties, we're able to now build out really amazing itineraries, and we can cater them to like multi-generational, family-friendly type things, but also couples and people just looking to get away and learn more about history.
I love that. And then Rome, we have Honor America Days.
Yes, Honor America Days in Rome. That's at the end of July. There's also Cycle the Erie, which I don't know if people are familiar with this, but cyclists bike from Buffalo to Albany. And they
along
stay
the canal.
Along the canal, and then they stay in different spots. So every year they stay in Rome on the lawn of Fort Stanwix. Like, it is the coolest visually appealing thing. And then there's a block party for it where we're a vendor at it, but so many things happening, live music and historic tours and biking tours and walking. So it's a lot happening there. And then in September, the city of Utica and the city of Rome are hosting a regatta. So people will leave from Bellamy Harbor Park and then they'll end at Utica Harbor Point.
That's amazing.
So, I know, it's so cool. I'm like, I know we're doing it for America 250, but we need to make this annual.
Yeah, it definitely does. I mean, it's something you don't see every day, right?
No, exactly. I know. It's like, it's such an asset. And last year was a huge year with the canal, with the bicentennial. So it's nice that it just so like seamlessly ties into what our marketing and history promotions are. And it's really made us assess, like, as Oneida County Tourism, but also with the county, you know, this is something that people travel for, and we're fortunate to have so much history in Oneida County. It's very reasonably priced and or free to visit a lot of these sites. So we encourage you, and look for programming, because they're also so great at doing different things throughout the year where they know kids are on summer break, or if they have a school break or something, they'll have some type of event happening so people can go and learn.
What I also love about this, I mean, you know, I'm originally from New Jersey, outside New York City, and even when I have friends coming up, we have friends that have a daughter at Syracuse. It's one of those things where it's like, come visit us.
Yeah.
But wait till you see all of the amazing things we have here. And especially this summer, there's so many different events that you can bring friends and family, anyone from outside the area who hasn't experienced it, right?
100%.
It's the perfect opportunity.
It is, exactly. Like you say, you know, maybe Boilermaker people are in town, and so it's just a huge opportunity. And I think Pride is fully alive during Boilermaker, but think of that throughout the entire year. When you have friends and family or people visiting, there is so much opportunity to go out and explore, and we encourage you, like, go to our website, go to our social media to find out what events are happening and learn more about the history. I think as I continue to grow older, I become more and more interested in, wow, this is really amazing that we have all of this right in our own backyard.
It really is.
It's like tourism 101.
It is, right?
You kind of look past what you have, and then you come back to it and are like, wait, this is really cool.
Yeah. So Sarah, thanks for coming in today.
Yeah,
I'd love to get together again. Maybe we go out and explore something together.
All right, let's do it.
Let's do that, right?
Sounds fun.
Perfect. So we will direct everyone to OneidaCounty250.com, right?
Yeah, you got it.
All right, I got it. And make sure that people get out there and explore everything happening in Oneida County with America 250.
Yeah, thank you.
Thanks again. Thanks for watching this week's episode of Mohawk Valley Living TV. Make sure you pick up Mohawk Valley Living on newsstands now, and for more content, go to MohawkValleyLiving.com. See you next week.
We're stickering everything, Finley.
It's the Made in America sale at New York Sash.
Good job.
I thought you two were getting ready for the sale.
We are. We're stickering all New York Sash products made in the USA.
Isn't that everything? It's America's best, installed in central New York for less. We're taking 25% off vinyl and engineered wood siding, acrylic bath systems, energy efficient windows, and entry and storm doors. Visit NewYorkSash.com.
Here's another sticker.
We are the best spine care facility in the region. We are providing world-class care for our patients. We are Central New York Brain and Spine Neurosurgery. Suffering from neck pain, back pain, frustrated because you can't get any relief? Let Dr. Q and his staff provide you with the care and compassion that you need. With the latest and greatest technology, Dr. Q and his staff will help get your health and your life back to what you deserve. Dr. Q cares about you. Call us today.
We are strategic. Want to know what we do? It's simple. We help you live your great life. That means great financial planning, straightforward investment strategies, and guidance when life throws a curveball. Retirement, college, taxes, and big decisions. Spend less time worrying and more time living. Strategic, life by design.
A fence is an important investment. It defines your space, provides security, and reflects on the pride you take in your property. At B&K Fencing, we just don't install fences, we build solutions. We take a hands-on approach with every client. Our commitment is to superior craftsmanship and durable materials. Whether it's classic wood, low-maintenance vinyl, secure chain link, or elegant aluminum, quality is non-negotiable. We ensure that every project, large to small, is built right, built to last, and delivered at a fair price. That's the standard we uphold at B&K Fencing.